Good evening, Kansas City. This is Zoe Sabido. I am a member of the United Nations Association of the Greater Kansas City chapter. I'm here with Dr. Nicholas of the Institute of International Medicine, and tonight we are talking about the World Health Organization. Good evening, Dr. Nicholas.
It's great to be with you. I love the work of the association.
So tonight's format will be a question and answer. I'll be asking Dr. Nicholas about the questions that we were given, and we'll just go from there. And our first question is, what is the significance of the World Health Organization? And can you provide some examples?
Like most people, I grew up hearing about the WHO and reading a little bit about it when I was going through medical school at the U of Missouri in Kansas City. And then I moved overseas. I spent 2 years working at the charity hospital in Shanghai, China, and then another 2 years in Angola, Southern Africa, and got a chance to work with the WHO and the various personnel associated with them in both of those contexts. And so I think that it's important that we understand their role in the world today. I'd like to begin with just a couple of them. There's something called Health for All, the Alma Ata Convention of 1972, which launched what was at that time the most united global health advance in world history. And then since then, we've had the Millennium Development Goals, which ran out in 2015, and now we're on the Sustainable Development Goals. These are all three worldwide united efforts to focus on health conditions and to generate improved health around the globe. It's an amazing, inspiring effort.
Wonderful. I believe like the sustainable goals, that's to 2030, correct? So it's like yes. A 15-year goals that we want to achieve. Okay, that's so right. Our next question was, how does the WHO help the United States, which has its own national health and disease agencies?
Well, to answer that, I'd like to go back to some of the achievements of the World Health Organization. Some of the most notable are the eradication of smallpox. There was a time when smallpox was causing millions of deaths and horrible disfigurement around the globe in the United States as well as elsewhere. And so when we ask ourselves, what's the relevance of the WHO to the United States? These are diseases and health conditions that affect the entire population. There is no way that the United States is immune from the diseases that afflict other countries. Ours is a global world of commerce and travel and trade and international exchange and study, and whatever disease, be it Ebola or measles or other highly contagious diseases that affects another country is going to affect us as well. So the United States does have its own wonderful health organizations, but I'd like to point out in the case of the CDC, the CDC cooperates very, very closely with the WHO. The CDC provides personnel, provides counseling to the global workforce that's going on around the globe. So there is no isolation when it comes to disease, whether it's infectious or not infectious. We are all indeed in this together.
Noted. Okay, so the next question we received was, what is the World Health Organization doing to mitigate the spread of COVID-19 in African and third world countries that do not have the resources available such like to rich nations?
Yeah, and I think it's very important that we realize that the low numbers reported about COVID in Africa and Southern Asia, for example, are very likely vastly underreported.
Hmm.
I work in Angola every summer. Angola is a country of 14 million people. Most people live on less than $1 a day. They don't have access to COVID testing. There are probably tens of thousands of people with the infection, and we will never know it because there's not testing, there's not surveillance, there's no reporting. Now, what's the WHO doing about this? Well, they are providing test kits in these countries. They are providing data gathering and coordination. We need to know where the disease is so that we can respond accordingly. WHO is also involved in training health workers in the recognition and treatment of these people. These are nations that just don't have budgets for health control. And so, thank goodness, there is the WHO that is really tasked with the responsibility for providing equipment, providing knowledge for these nations. Let me emphasize here that disease leads to poverty.
Hmm.
Disease leads to poverty, which leads to refugees, which leads to shrinking markets for buying goods, which leads to civil unrest, which leads to war, which leads to terrorism. It is in the interest of the United States to keep the global health as high as possible, because all of these maladies that I just mentioned will come to our shores. They're already here, actually, to some degree, if we do not do our best to provide for the needs of the world's most poor.
I agree. All right. Our next question on the list is, why is international cooperation / collaboration important to fight a pandemic?
So this particular pandemic is a disease that is highly contagious and has been proven communicable through airliners. Basically, that's how it got, from China to everywhere else. And so cooperation between nations, between governing bodies, is essential so that we can control. So we will, first of all, know where is the disease and where is the disease going next, and so that we'll be able to provide information to one another about what works, about what doesn't work. 17 years ago, we were faced with the SARS epidemic. SARS has a lot in common with COVID. It's just that there's 100 times more people infected with COVID than there was with SARS. But we learned some things from the Chinese, from the Australians, from the Japanese about the way they managed to contain SARS, which has been used and is very relevant today. So again, we're not in isolation. The information that we learned from them, from other countries, is the information that we are applying in our quarantine and in our disease surveillance here in the United States. So this kind of cooperation is essential for success.
That's very true. And then our next question was, how is the WHO funded?
So the money for the WHO amounts to about $4 billion a year. Some of it comes from dues from the 192 member nations, but that's actually only a small part of it. About 2/3 of that money is voluntary donations given by nations on top of their dues. And the United States is the biggest donor. We provide about 20% of the WHO's budget. About 10% of their budget comes from the Gates Foundation. The number 3 donor is the UK and Germany and Japan. So most of it is voluntary donations. We recognize the value that the WHO is providing, and we're funding that value.
Alrighty. And then the question that follows that is, can international cooperation happen without the WHO? And what could happen without the WHO?
Right. And so how would we negotiate between nations if there was no mediator? So right now with COVID, we're faced with a problem that is affecting almost every nation in the world severely. And if one nation goes to another nation, you can imagine the thousands of relationships that you would have to have, you know, the United States with Great Britain, with Mexico, with Canada, with Indonesia, with China, with Taiwan, and then all of their connections. It would be chaos. And so having a central organization that is tasked with coordinating all of these kind of important joint works makes for great efficiency. It's not perfect. The WHO is not perfect. They have made some blunders along the way, as all of us have, but we learn from that. Just because the firemen are not 100% successful at putting out the fire doesn't mean we shut down the fire department.
Very true. And then our final question of tonight is, what is the WHO doing to improve its cybersecurity?
There have been bad actors in the last few weeks who have taken advantage of the panic and the high internet traffic to prey on people and to prey on organizations. The WHO reports something like 6,000 identifications and passwords were stolen by one of these bad actors. They, of course, are taking steps, as all of us are, to improve our security. This meeting is going on right now via Zoom, and we know that Zoom has itself been under scrutiny for breaches in security. So I think what the WHO is doing is in line with the industry as a whole for trying to protect the us during this particularly vulnerable stage.
Alrighty. Thank you so much, Dr. Nicholas, for answering those questions with us tonight. And I want to thank those that have joined us today. Please visit our website, the UNA-GKC.org, for more information. And if you would like to join, that's where you can find us. Dr. Nicholas, would you like to add in more about INMED?
Our biggest event of the year is the Humanitarian Health Conference, which is normally an in-person event with 400 or 500 people. This year in Kansas City, it will be virtual, which means people can join from anywhere in the world. And I would like to invite you to come and join us for the Humanitarian Health Conference. It will be for 4 hours on Friday, June 12th. And you can find out more information by going to our website, INMED, INMED.us. Love to see you there. You will be in the company of many like-minded, like-hearted individuals who are concerned about the health of the world and about our joint efforts to achieve that goal.
All right, that is it for tonight. And thank you again for joining. Have a good night, everyone.